So, probably 30 years ago, I had my first exposure to plastic surgery, and a plastic surgery friend of mine, who became a good friend, great guy, said, "You need to become a plastic surgeon." And it was really boring. In fact, I did about 6 months of surgery, and it's like, okay, this really bores me, so I need to do something that I can research and have fun. And aesthetics have come and gone in my life for a long time. And I was approached by one of your tormentors, part-time mentor, and he says, I think it's time for you to start pulling in some of this information. I said, I was looking at this piece of equipment. He says, that's the one I'm selling. That's the one I'm looking at. That's what I want you to be interested in. Because at the time, I was making referrals to tons of different people in area. We were sending people over to Germany, South Korea, because things like a lot of this stuff was not available here. I mean, because they wanted to do stem cells and other things at the same time they were doing their aesthetics. And I said, okay, then here's the places you need to go. And then it became popular here. I'll say 3 or 4 years ago, stem cells kind of got a semi-approval. We just got a big push from RFK recently. And the aesthetic model has been around, she can go into a little historical, has been around for a long time. This technology has not. There's nothing like this technology that has combined the pieces together, and she's going to make it easily understood. But there's nothing like this in all the other part of the country. I mean, it's available all over the country, but there's nothing like it, another piece of equipment like it. And I was like, okay, this is what I want to do for people that are interested in aesthetics, but also for women's health. And she's going to get into that. And Christine has taken away from her time in Florida. Go figure. Come up here to the cold weather. I mean, really.
Hey, I'm a Midwest girl. I'm originally from the Midwest,
Indiana,
but
right?
I do live.
And so I apologize for bringing you from the warm
totally
to the cold.
You're totally fine.
Christine, take it away.
Thank you, Dr. Bob. Well, I appreciate you as well. And I just want to first start by, I didn't even know that you were going to get into plastic. So I actually was a practice manager and administrator for a plastic surgeon's office, dermatology, and also med spa for the last 20 years. My kids went and left me, they went to college and grew up, what the heck, right? And so here I was, and I decided, I was like, my degree's in education, and so I wanted to get back into education. So I got away from staying behind the desk, and now what I do is I travel across the country and I educate patients on this technology. And the reason, I didn't just pick any company to do this. Like Dr. Bob said, there's really nothing like it out on the market aesthetically, but now what's beautiful is now we can use it for female wellness and also male wellness. We even have a device that treats dry eye, which kind of tells you where this is going, right? And so, but my goal today is to talk about what's called, I'm gonna start with this. Has anybody ever heard of microneedling?
Say it again.
Microneedling. Microneedling. Okay, so microneedling basically is you're taking they're little needles, right? And you're taking it to the skin and you're putting a controlled injury to the skin. So when you put an injury to the skin, what happens? Exactly, it repairs itself, right? So our technology now, so what we did is we are now delivering what's called radio frequency technology into those microchannels. And so it's bulk heating controlled, just so you know, controlled heating, you're not gonna burn. And it's being delivered into those microchannels, whereas traditional microneedling is just getting to that surface of the skin. So it's great for texture. But now we want to get in and we want to go beneath that epidermis dermis level. We want to get into where that collagen and elastin lie. We want to get into, I always say, when we start doing this and we're doing this, that bulk, we have a little bit of bulk here. So with that controlled bulk heating, we can now get in there, eliminate the fat, but we can also get into where the collagen and elastin lie And we're basically doing the same controlled injury, and then what's it doing? It's repairing itself. So why would we want to do this? A couple of reasons. So as we age, we lose collagen from the age of 28, that's when it starts. And then when we hit menopause as you know, ladies, it loses even more rapidly. Estrogen loss, you know, and a lot of other factors. But that's what this technology can do. It can rebuild and, you know, firm the face again without plastic surgery. So that's why I left what I was doing, because I didn't actually believe in plastic surgery anymore. I started to see, you know, younger and younger people going in there, men and women. And what people don't understand is when you're having let's give a facelift for example. You're having a facelift at 55. I'll be 55 this month, and I'm like, just can't even imagine. But you're going in and you're getting a surgery. What are you doing? You're basically taking the skin away. You're not repairing or fixing. We're preventing those big things from happening. We don't want to go under the knife. There's a lot of thought nowadays, a school of thought, that if we can go as long as possible without doing that, why wouldn't we? Not only that, but the average cost, I will tell you, my plastic surgeon charged $50,000 for a lower facelift. Okay, so you're getting this treatment is nowhere near that. Okay, so just don't be alarmed. It's nowhere near that. So okay, so now we're going to get into the nitty gritty. So basically, you want to know it's FDA indicated. Okay, so that is a great thing to know. It's been tested, it's been, you know, cleared, so it is something that's safe and effective.
So FDA indicated, does that mean FDA approved?
So I get that question all the time.
Yeah.
It depends on the actual class of the laser. It's not a laser, but it's a class 1 or class 2. It's indicated. Approved would be a class 3, 4, and 5. This is a class 1, 2. So it's considered indicated, it's not the same ballpark. But that's a great question.
Hey, Paul?
Oh, just so it doesn't fall under the same category that.
No, they don't, because of the class. There's different classes. When they go to FDA approval, they have a class 1 through 5. So this is it's a class 1, 2. So they don't need the actual approval. Like it's still FDA indicated. It's gone through all of the indications. It's just not, the wording is just different.
And the price. So what do we get as we decide we want to go with this? So what is the guarantee for us if we're satisfied or not satisfied, or how would I say?
Well, let me go, I will answer those questions for you for sure, but let me go through the actual like modality and the treatment part of it, and then we'll get to all of that part. And so where can you be treated? The beautiful part is you can be treated pretty much anywhere on the body. There's 2 areas, the lips and this lid.
Yes.
Okay, so those 2 areas you cannot. And then, you know, what's it doing? Like I mentioned, it's helping rebuild that collagen elastin. Okay, so I really like to talk about the tips and how they're delivered into the skin. So we have what's called a resurfacing. It's going to be just that. So it's a 0.75 millimeter, very shallow, just to the surface of the skin. Okay, that's going to be more of like that texture. Okay, and then we have the traditional, the Morpheus8. That's going to go to 4 millimeter to 5 millimeter. So you can go at different depths. And so what the beautiful part about that is, are you going to go to 5 millimeter on your forehead? Absolutely not. That would terrify me. No, you will not do that. So you're going to go at a shallower depth on that forehead. But let's just say you're like, oh my gosh, I got to get rid of this thing that's underneath my chin. It's called a cemental area. You can go at a deeper depth. So we can really target that area, and the pre-jawling that we start to get, we can really target that as well. So you, again, different depths. The prime, and this has 24 small tips to this device. This one is called a prime. It has 12, so half the amount. Why is that? So as we age, we start to get these areas around the mouth, under the eyes, above the eye, this, what we call, I always call this my two sons, you know, muscle that I build over time, you know. So you can get into this area and it's much smaller. So you can get into those really, really small areas. And then you have body. And you can see the body goes now from 7 millimeters to 8 millimeters. So now you can go deeper. So when you have those pockets of fat, like the stomach or the flanks, inner thighs, outer thighs, arms, right? We talked about arms. You can target that fat, but you're also getting the texture. So you're fixing that, you know, that you're doing that lifting and tightening, and you're rebuilding that collagen and elastin. So I just like to go over those tips with you. Most common questions. Okay, Christine, how many treatments am I gonna need? And what I will always say, you know what? It's really dependent on your age. Are you a smoker? Have you been in the sun your entire life? So it's really important to do what I call a consultation. It's not a one size fits all. However, most patients are 3. So it's 3 sessions, 4 weeks apart. Okay, what will I look like when I leave? Do I have to take off work? I mean, I think I'm not gonna say who it is, they can say if they want to say, but because people have done it here. For me personally, I had it done. You'll get, it's a small microneedling, so you're gonna get these pinpoint little dots like bleeding, but it's not, you're not drip bleeding or anything like that. You'll wash your face the next morning and it looks like you pink, like you're out in the sun. So it's a little bit of like almost a sunburn effect, okay? Yes? Yeah.
I'm on blood thinners, so is that gonna?
It does not matter, however, you will have a little bit more bleeding. You may have a little bit of bruising. I always like to say that with anybody that's taking fish oils, blood thinners, if you drink alcohol, I would advise it go 48 hours, you know, so that way you're not having those. But that's common really in anything you do when you have, whether you have your blood drawn, whether you have, you know, any of that, you have more risk of bleeding and bruising. Yeah, great question.
We have a whole do's and don'ts
Yes.
sheet that kind of walks you through, you know, weeks before, 2 days before, day of,
Yes.
24 hours, 72 hours, 2 weeks, a month later.
And that's a great provider, because you know that they've got all that, you know, they know exactly what you're supposed to be doing or not doing in that time period. So 4 to 6 weeks.
Do you put us to
Yes.
sleep? Or did you
Oh
get-
gosh, no. Oh no, that's the beauty of it. This is not surgery. No
Is
anesthesia.
that 24 hours?
No anesthesia. So we do, it's awake, and then you use topical numbing cream. So the topical numbing cream is applied an hour before the service. You will actually numb longer than the actual treatment itself. And so this numbing cream has been basically,
When they're ready.
what was
Sorry.
that? Oh no, you're good.
He has a, like right after a 24-hour.
Awesome.
Good
I have the day of and the next day.
Oh.
He already
Okay,
had
awesome.
the treatment.
Okay, awesome. Yeah, so
He
then
was-
afterwards
He
we'll
was
show.
our experiment.
Yeah.
I love it. You
Our-
gotta have
Our
that.
lab
I'm
rat.
on blood thinners.
Yeah. So yes, the numbing cream is sufficient. No, you do not have to go under any anesthesia or anything like that. So then what happens after? Like, what's my downtime? Again, it's gonna be like that 48 hours. No makeup, don't put anything into those microchannels. You want them to heal on its own. You can put a little bit of lip gloss or not guys, chapstick, a little bit of eye makeup, but nothing that's going to interfere with that healing process. Surgical grade sunscreen. A lot of people don't understand the difference between the Neutrogenas of the world and a surgical pharmaceutical grade sunscreen, okay? So there's a big difference. It's what's in the sunscreen. The percentages, they're much higher. So sunscreen, when will I notice a difference? That's the big question. So some people will notice it after their second session, some people after their third, but typically you'll get the best results, noticeable results in 2 weeks. Oh, you're fine, you're fine. And then 4 to 5 weeks your collagen and elastin will be at its highest production after your last treatment. Okay? Now we're gonna get into some before and afters. Does anybody have any questions? Okay. So, I love to show this particular patient. She was everything we tell a patient not to do with her skin. Okay, so big sun worshiper, heavy smoker, and so remember when I showed you those tips and what they all did? So she did a resurfacing. So she did do this, and this is one treatment. I'm just gonna tell you, this is one treatment. So she did a resurfacing, and then she did the Morpheus full face and neck, and then we went in with the prime and really focused around the mouth, under the eyes, this glabella area. So she'll need at least 3 to 4 more.
Under the eyes, huh?
She did under the eyes. No, the whole face, she's gonna need the entire treatment again. But we did do around the mouth and under the eyes on top of the Morpheus full face and neck. That prime, remember the 12 pins that's smaller? We did that as well.
So she had 2 treatments.
She did it all at the
Two
same time. Nope, you can do it all at the same time. It's just using different tips. Yeah, it's great. So, back in the day when I was working for a plastic surgeon, 100%, I would have said this patient needs a lower blepharoplasty. 100%, hands down. So we were able to go in with that prime. She has what are called festoons. We were able to go in there with that prime and really concentrate and see that fat pocket, really concentrate in there. And that was 3 sessions, 4 weeks apart. No surgery. So that's a beautiful thing. And then we did our full face and neck.
And how much did that cost?
Well, this is different. I mean, we'll go over all the pricing, but you gotta remember she just did under eye and then she did the whole face and neck too. So you have to kind of look at, and we'll look at all the pricing because we do have it for tonight and it's again event pricing. So when we're done, we'll go over all of that. So, males, you know, we tend to get really heavy through this forehead, this frontalis area. So we're able to soften that up. Won't get rid of it 100%. You know, you built that over time, that muscle. So, but males seem to be stronger. Botox, you know, has been used in the past, but a lot of people don't want to use Botox. It's very costly. Botox can run you $800 to $1,000 every 3 months. So you'd rather fix the problem versus mask it. I like to mention this because it's hugely important. None of us are symmetrical, none, you know, on our face. And so what happened with this particular patient, she has this, you know, little fat pocket, this unevenness on her neck that was really bothering her. She was also getting these nasal folds that were pretty heavy, you know, and through here. So what we did, we were able to go deeper in this pocket, right? And really even her out. So not only was she getting that lifting and tightening, and she was getting that lifting and college remodeling, she also became more symmetrical. Men just seem to respond, I know it's unfair, but they just seem to respond a lot better. They rebuild collagen, they, you know, they don't get cellulite, you know, it's all that, you know, stuff that, but this is a male, 3 sessions, 4 weeks apart. That's without a neck lift and without surgery. So that's impressive. I love this particular photo. For any of you that know anybody with cystic acne, it's absolutely horrible for that person. It's the only device that can treat overactive cystic acne. It basically, that bulk heating goes in there and it kills the bacteria. So we can treat that without the medications that used to be used that are really harmful, honestly. This is scarring. He had, you know, some really bad acne scarring from years ago. We went in there and treated that with the same device.
Wow.
Bad accident, we had this scarring, able to treat. This was, I believe, 5 sessions just on that scar though. There you go, arms. Okay, so as we age, this patient doesn't have a lot of bulk. just loss of elasticity and collagen in that area, which is very common. I always say, as we age, we drop like a rock, which means our skin, everything's dropping. And that includes our arms, our knees, you know, the inner thighs, outer thighs. So this is a very realistic photo. You're not gonna have arms that look like you're 20 again, but that's a really nice difference. It's about a 10-year, I would say. And that's 3 sessions. Or did you want to see that too, Kathy? There you go. Yeah. So, cellulite. If anybody tells you they can get rid of cellulite 100%, they're lying through their teeth. And so this is what we can do though. We can get an 80% reduction. Okay, so you can really smooth that out. You can see she even got a little bit of debulking as well. But I'm very realistic when it comes to cellulite, because if you tell somebody they're going to get rid of it and you don't, then, you know, bad expectations. So knees, beautiful result here with the knees, can be treated.
So we interviewed 10 women, just out at the mall, interviewed them, and 8 out of the 10 women talked about their knees, and I'm like, really? That's
My knees are
all of that is what you want to treat? And it really told me something that, you know, I'm a little bit behind the 8 ball here as to what's important.
Yeah.
And
I'm an E girl. Because I look down and because when you're looking down at the angle, that's all you see. I played tennis for years, so what happens is that sun exposure, basically you're losing collagen in that area as well. For me, you know, I have that. So as soon as I get the time, I'm going to actually do my knees as well.
From a plastic surgery standpoint, you work for plastic surgeons.
Yeah.
I really like the way they mark off where they're going to be treating. Where do you learn that? I mean, I remember doing
Well,
that.
typically they go up. Well, typically they'll go up to the area where they see that, you know, one, you don't want to go up too far, right?
Right.
But they'll go up to the area where they start to see it dropping. It's usually right around that mid thigh. It's usually like right there.
Okay, and that's where they recommend
Yeah.
stop anyways.
Yeah.
Okay.
I mean, where the Bermuda shorts are.
Yeah.
Yes. So typically it's going to be this area, like all around this area. Now, if you have let's say you're on a GLP-1 and you've lost a ton of weight and you have that inner and outer thigh drop, you can then do the whole inner thigh and knee. But, you know, that's just something you'll have to assess.
So part of what our offering here at the office is functional medicine too. Now, what do I mean by that, functional medicine? So collagen, this is one way to get collagen to really supercharge and start filling in the holes. Well, IV therapy is another way to improve collagen. And you've probably heard of peptides. Anybody heard of GLP-1's a peptide? There's over 7,000 peptides in our body.
I take collagen peptides, I go
Yeah.
on my coffee every
So,
Yeah.
so we can give these IV and NAD, glutathione, NAC. Has anybody ever heard of any of the peptides in general? Anybody? Okay. So, in addition to the radio frequency and the heat that this machine offers, pre-treating with IV therapy also helps significantly.
Hydrating the body.
Yeah, it's not just hydrating, it's actually
yeah.
sending the anti-inflammatory signals. Now in Europe, some of the things that they're doing, and we will be doing it here as well in the United States, they're using stem cells. In addition, they'll go through and they'll create the inflammation, and then they'll give stem cells 24 hours later. And the stem cells go in and not just supercharge, really supercharge the healing process and increase, you know, a doubling, tripling effect of the amount of collagen. It's all about collagen.
Right.
And the plastic surgeons
Can't.
don't even talk about that because they can't. There's nothing they can do about increasing collagen. They don't even have a conversation about it, which is astonishing to me.
Yeah.
And from an internal medicine, my background is ICU and ER, and I can't tell you how much of the healing we would give nutritional therapy to people who were down more than 2 days. The people who got nutritional healing got better. The people who didn't had a much greater chance of not making it through that ICU experience.
I have a question. I mean, it's a mechanical device penetrating the skin. How do you avoid infection?
Yeah, so this is actually, when you're numbing, it's the microneedle is only going down to a certain percentage, but that is on you too with infection. As far as when you're getting home, you know, you're not going out and mowing the yard. So there's lots of things that are do's and don'ts.
Right, so, excuse me, I wasn't clear.
Yeah.
The device itself, how do you prevent?
Oh, we don't reuse the tips. Those tips, every
Okay.
time you have a new tip. Every patient gets a new
Do the
tip.
tips get hot? Is that how it avoids?
So that's part of the deal.
Injecting bacteria?
Well, it comes out of a, where's the,
Machine.
no, not the machine, the VTone tip we had. Everything is sealed in a pack. Yes, so everything is yours, like when you
So that's a
have,
throwaway?
yes,
Okay.
we never reuse anything, yeah. And I'll use that, that's for our next device, but yeah, so just so you know,
Okay.
each patient has their own.
So, so does that hurt?
Well, that's where the numbing cream comes in, that's the pain management, that's what's gonna
That
go
goes
first. Yep, so you're gonna numb for over an hour, and then, or about an hour, and then the treatment is right after.
You know, that's a good question. We've had some people that were oversensitive. I would consider them, you know, twice as sensitive. And we had to let the numbing medicine stay on there, not for 30, 40 minutes, 2.5 hours. In addition, when it was over the lip and a couple other areas, we have the option of giving nitrous oxide, which is laughing gas. You know, the dentist will give it to you and knocks you out for, while he gives you the shot or whatever. But that helped her get over the edge of the discomfort.
Yeah.
Because we knew it was coming and she'd already had one treatment, and so we put a little laughing gas in there and boom, she got through it fine.
Yeah,
Do you ever do one eye?
no, you
You
wanna
gotta
do
do
both.
both eyes.
You would wanna do both.
Balance.
Yeah, you would wanna do
Well, I
both.
don't have balance now.
Yeah, but we would look at you and we would go at different depths. You wanna get that correction, even if you have one eye that's bothering you more than the other. You don't wanna leave this texture and all of this the same and you treat this, cause then you're really uneven. Yeah, so we do both, but we do different settings and energies.
I'm really, it's really kind of interesting, this technology, because it's really, I would call it at least 20% art and 8% technology, you know, expertise
Skill.
and skill.
Well, yeah, it's a sensitive area. Is that,
Yeah,
Well, the skill comes in, you're using a hand tool. So the skill comes in as to how you apply it, the distance, the pressure, and all that other stuff.
All of that, all the above.
Yeah, there are different energies and settings for
Right.
each patient.
Yeah.
So, one thing I like to note, this is not a laser. So, when we are in aesthetics and we talk about skin types, this is what's called colorblind. This technology is colorblind. You can use it on any skin type. So no matter if you're the fairest, blue-eyed, burn easy, to the dark complexion, black hair, you know, brown eyes, dark. You know, I have Native American in me. I am like it's a 1 through 6 is what the scale, Fitzpatrick scale is. So I am on that cuff, I'm like a 3-4. So I tell every person that I go in and get a treatment that I do have, you know, Native American in me, so that they know what settings to go at. But with this particular this particular device, it's not a laser. Okay, so just it's safe, it's colorblind technology. Again, the flank area, and I didn't even mention this, it wasn't really texture as much as debulking. So wanted to debulk. This patient lost a lot of weight, GLP-1s, had that sagging, and we were able to lift and tighten. That was 4 sessions, not 3, so there was more sessions. Stretch marks. Again, you know, this was treated, this was actually only 3 sessions. Had a beautiful result. Another patient with stretch marks, and you can see she had a little bit of bulk here, so we were able to debulk her. Okay.
Are you removing tissue?
No,
It's not a vacuum.
Shrinking
No,
it.
so it's not liposuction.
Right.
So what happens to the fat? That's because I know where your brain is going
Right,
with that.
right.
So basically what happens is it's melted and it goes through the lymphatic system. So you can have a percentage that can do that. Now, if you're getting a lot of fat removed, that's where liposuction, assisted liposuction comes in. Yeah, so this is different. We don't have to, again, go under the knife and do liposuction. So I'm gonna go over just, something that is super important to me and I'm very passionate about it. And this is gonna be for all the females in the room. You arrived. So this is gonna be for all the females in the room. And this is what I feel like this technology is being, it's amazing. So as we age, we lose collagen, right, and elastin. Not just here, and not just in the skin, but internally, okay? And so as we, have babies, we go through menopause, we, just age itself, we can have some of those, I'm sorry? Oh, yeah.
So she can watch.
Yeah. So, again, losing collagen, healthy tissue. So, what InMode has done is brought on this device. It's called Empower, and I love the name, Empowering Women. And so, what happens when we don't work a muscle? We lose atrophy, right? So we have what's called the pelvic floor, right? We have that's a muscle. And so when we don't work it, we lose it. And how do we work that pelvic floor muscle? It's a word that we call it, a term.
The Kegels?
Yes, I love it. Okay, so how many of you
Kegel.
actually do Kegels? Be
I
honest.
just did 3, talking about it.
You do them, I love that. That's awesome. How many do you think you do?
I had physical therapy. I mean, I had it for 3 months.
Yeah, okay.
Yeah.
Okay, so basically, we have technologies called electronic muscle stimulation. It's doing those Kegels for you.
Okay.
Now, how many Kegels do you think you do in a month? How many, does anybody, how many do you?
is it?
Not enough.
Basically, you're contracting, like your stomach area, the pelvic area, you're doing your own, that's a
20 days.
Kegel. How many?
10 a day.
10 a day? Oh, please, nobody does 10 a day. Okay, I'll tell you what I do. So I'll sit at a light, and I'm like, oh, I gotta do my Kegels. So I'm like trying to do them, and a song comes on, and it's like squirrel. So I maybe get 3. You can get, no lie, I'm telling you, wait, no, I'm gonna make it more fun. How many Kegels do you think that this device can do in 30 minutes? You can't answer, and you can't answer. Gotta keep quiet. Take a wild guess.
I don't know.
I had it done, but I
Frequency
don't
and the
know.
input.
How many it
Yeah,
was.
so take a wild guess. How many do you think you could do in 30 minutes?
Thousands.
Okay, how many thousands?
Oh, wow, here we go.
I love it. I like that you're.
I don't know. It depends on the frequency.
No, it doesn't actually. 30,000
Okay.
Kegels in 30 minutes. Okay, the frequency,
I didn't know
as if you're atrophied or if your muscle isn't as strong, then the energy is lower, and as you get stronger, it goes up, and then it's like you have this little teeny tiny bicep, and by the time you're done with the treatment, you're like pumping iron. And what is this great for? Urinary stress incontinence, and vaginal dryness, that atrophy, this is important. We talk about health and wellness and prevention, and this is what is so important. We talk all day, we can talk all day about the aesthetics, but not internally in our overall health. Yes, Dr. Bob?
So, I thought it was a bunch of sales and marketing hogwash when I
Yeah.
heard 30,000. I did, and I spent probably 6 hours researching that. And
I know, it's hard to
I was
believe.
like,
I thought the
she's
same.
right, 30,000, and it's like, nobody's ever done 30,000 in their lifetime.
No.
And,
No.
and so I've kind of been tracking my mother. My 93-year-old mother's went through this 6 treatments. And she's notice things that are tighter and not a problem. She's not getting up 4 times at night,
Yes.
et cetera, et cetera. And it was kind of interesting to hear that, you know, from her, because she didn't bite ever.
Yeah.
And so it was really important to me because we have this urinary tract infection program here. We've been very successful. I've been audited by Blue Cross Blue Shield. Why don't you admit people to the hospital for urinary tract infection? Because they don't get hospitalized urinary tract infection because we have this program. So that's why I spend $30,000 a year more on lab, you know, to do a urine CNS. But I saved them $1.5 million last year because they didn't admit people for urinary tract infections. And this was the deciding factor on why I bought this machine.
Yeah.
Because of the amount of Kegels and the amount of problem this occurs.
Yeah. And
9 out of 10 failed bladder surgeries, bladder raising, you know, prolapse surgeries fail.
And I have something, a story to add to that too.
Very
so.
good, but this was the reason. This is how important this is.
Yeah.
Surgery failed.
But, you know, now you gotta understand, I spend $30,000 more in lab work and doing urine CNSs on my patients per year. But when I got audited by Blue Cross Blue Shield, I saved them $1.5 million at the same time. This machine,
Yeah.
I suspect, will be paid for by insurance at some
Yeah.
point.
Yeah, absolutely. So when we look at what is the current treatments for stress urinary incontinence, what's the current treatments? Diapers. Do you know that adult diapers outnumbered baby diapers last year?
Oh, I believe it.
I believe it.
Whether it's panty liners, pads,
I gotta go to
diapers.
a concert.
Gotcha.
Nice to meet
I know,
you.
you already talked about it.
Did I?
Thank
you.
And you're welcome.
Good
Take care. And so that's pretty sad. We don't want to walk around wearing diapers. That's just, no. Well, I'm not doing that. I refuse. What you were saying, Dr. Bob, about some of these surgeries that have gone wrong. Some of them, the mesh and slings. I actually had a patient who told me the story. She got the mesh inserted. She wasn't able to eliminate all of the urine, and each month she was getting a UTI because she could not eliminate everything because the mesh was put in too tight. So we want to prevent the bad things from happening, having the surgery. So how do you do that? We're gonna go ahead and we're gonna get that muscle nice and rebuilt like you when before you had kids, before you went through menopause and things like that. So with this being said, the VTone, basically, again, it's doing that basically flexing for you, that almost like a plank. When you're doing the plank and you're like squeezing your muscles and things like that, it's doing that internally, 30,000. And it's gonna help with, you know, that pelvic floor weakness, stress urinary incontinence, 6 treatments, that's it. So 6 treatments, it's once a week for 6 weeks. And you're gonna do it for 30 minutes. So a lunch hour before, you know, you go to work, after you go to work, very easy, does not hurt. Okay, there's no numbing involved. You're not, you know, none of that. The only thing that you will feel sore, like if you went to the gym and worked your muscles and you know how you get that soreness, it's the same thing, okay? So there's no downtime other than that. And that's it. So that's the presentation. That's what Dr. Bob has, you know, brought onto the practice. I'm gonna tell you that, you know, again, this device is my favorite because of just how it's changed women's lives and men when it comes to like the aesthetic aspect, but women's lives when it comes to real issues when health-wise. So
Yeah, now I had that done here,
yeah.
and I was from the gynecologist, stage 3 prolapse.
Oh, okay.
Okay, and I was gonna have it done at her office, and then all of a sudden he's like, "We got this."
And tell me, like, how does, I mean,
Okay, yeah, it's just a sensation, just you know, it doesn't hurt, it's not uncomfortable, and I don't know, did I have 5 or 6 treatments? I can't remember.
I think
6.
so.
I did have the 6.
do you have that little device?
And I think, after that, there was a like, maybe 50-60% better. But I think right now, even though it's been how many months, a couple months, it actually, it's not even an issue.
What happens is you don't notice it.
I
You don't
think-
notice you're doing less than what you had to do before. You just kind of go about life and you're like, oh wow, I didn't have to put on a panty liner today.
Well, I never did,
Yeah.
but I never had the urgency at nighttime.
Yeah.
I only did because I drank water before I went to bed.
Yeah.
So I'd get up, but I didn't have that, but she diagnosed like a 3-stage,
Yeah,
you
that's
know, like,
pretty.
yeah, I was pretty, but, you know, I'm thinking, I don't really feel that bulging,
Yeah.
you know, so it's probably at least maybe 70, 80, maybe more.
And so what I would say to you, and I know Dr. Bobble says, you need to maintain it.
Yeah, okay,
Like
that's
with
what I was wondering.
anything, yes. With if any muscle you don't use, you
Yeah,
lose.
well, yeah, I
And
haven't got to
so-
the physical therapy to do it, but I could probably, like, if this is like 30.
Yeah.
What is this exercise you do that she was talking about before?
What we all know is women how to
It's
do
women.
it, but it's basically you're contracting.
You're just working the,
pelvic
trying to work
area.
the muscle, trying to work the muscle.
And many don't know how to do it correctly.
Yeah.
I will tell you that is a very common thing that women don't know. Some women never done it in their lives, never were taught that. I'm a 70s girl. I mean, I never even heard of stuff like that, you know, and we didn't really talk
No,
about
no.
female health and that kind of stuff. Like for me, when I first got, I'm even getting blushed now talking about period. I said the word period and my face would be red. And so nowadays though, we can't be quiet about it. We have to talk about it. We have to like make sure that we're all, you know, knowledgeable about these other treatments that aren't surgery.
No, I didn't
And
want
I-
surgery because I
this
read
is
enough
the
about the
device.
meshes that,
Yeah.
That's the size,
boy, if they
very
fail,
small.
you're in trouble.
In the 60s and 70s, there was a big push towards isometrics. Remember that? Where
Yes.
you just sit
Yes.
there and you contract your muscles and contract,
Yeah,
and you're supposed to build muscles. Well, we call that stress.
yeah.
So how often would it be advised to do this?
Yeah, I would
I
say
mean-
for you, probably you're gonna, like, if you did the 6 and you're seeing a 70 to 80, I would say probably 3 a year. Like meaning, I would go
through
another,
another session again?
or I would go through the 6 again in about 9 to,
Well, that's-
12 months, do the whole 6 again.
Okay,
And then you can just continue to do like 3.
because I got a lot of things on the plate, don't I, doctor?
Yeah.
Stem cells and all kinds of stuff
Yeah.
coming up that I'm
Yeah.
gonna be doing.
But it
I don't want
definitely-
surgeries.
Yeah,
I don't
And
want
again,
cut, I don't want my knees cut, I don't want.
80% without surgery is a pretty darn good outcome
Yeah.
in my mind.
Yeah.
And listen, I'm gonna tell you this too, with the Morpheus, this is not surgery, so you're not gonna have surgical-like results.
Yeah, I don't,
Meaning in the sense of you're not gonna have this like, oh, I'm just gonna look like this when I get done. That was to answer your question. You said earlier, well, what if I'm not happy with it? This is where I have been in the business for 20 plus years, and I'll tell you, before and afters make or break a practice when it comes to aesthetics. And so, you're gonna just get some good before pictures and some good after pictures.
So how long does that last?
So yes, great question. So we all continue to age at different paces, right?
What was your question?
How long does it last?
Oh, okay.
And so what I will say to that, it's up to you. Remember we talked about this earlier, for you to do your part too. So staying hydrated, you know, taking care of the skin, wearing sunscreen. But you should only need one treatment for maintenance a year to maintain. Unless you've gone through some major, life changes. You know, a lot of patients that unfortunately have gone through like chemotherapy, patients, just there's other life stuff that happens. But if you're doing the same thing and you're taking care of your skin once a year. Now, there's gonna be a point in time, I'm just gonna say it, when you get to be where it's not gonna continue to do the same thing it did originally. And that's when you're in your like 80s and you're just, it's just not working the same, and you'll know. That's a great question.
So can you pick a part of your, like a part of your face that you want done? Say like if you want your eyes and then forehead and cheek lifted and.
I am am the firm believer, if you're gonna do this, you need to do the entire face and neck.
Right, okay, yeah, well.
You don't wanna just pick, I mean, you can do like your, under eye.
Yeah, this way they get problems like your ear.
Yeah.
There.
Yeah. Yeah, that would be a full face and neck, and you would get that tightening.
Yeah, because you're spending the money for the needles.
Right.
For the-
You want to make sure you get your money on that needle.
Yes.
Yeah, that is true. The tip. Yep.
There was a procedure, and I don't know if they're still doing it, where they would do the tiny burns into the skin. I think they
That's
call
a CO2. That's a resurfacing.
Actually, when she's talking about, I think our knife cuts,
No,
microscopic knife
this
cuts.
is actual needle that would burn into, make little tiny holes in your skin.
That's microneedling.
Yeah. that's
Yeah,
microneedling.
microneedling. Okay, how does that, the microneedling?
Oh, so she came just a little bit after my beginning of it. So this is great. So microneedling, this is microneedling, but we have added radio frequency technology to the microneedles.
So you don't smell your skin burning?
No.
Okay.
No, that's old. That's the old. I know
Careful,
exactly.
careful.
No, I'm gonna be 55 this month, so I get it. I'm like definitely in that age.
Yeah.
Yeah, I'm definitely old
I
technology.
think this technology is this is a pretty simple technology, and don't you think the learning curve was like hours?
Yes.
I mean, it was like, you can pick this up very, very quickly on
Yes.
on the how-to, the little idiosyncrasies about the anatomy of the face and, things like that. Make it a little bit different, where the art's a little bit different, but traditional microneedling is a very unexact science, and you gotta be pretty good at estimating what depth you're going. The depth is already dialed in for you, and it's perfect every time. When you want to do a little bit more because you're going over an area that's a little bit thicker skin, and you want a little bit more of liquefaction of the fat underneath, you can go a little bit deeper. You can dial that right in, and it's simple, quick, and it's really interesting.
Yeah, they've done a lot of years of testing and a lot of it can only go to a certain depth. You can't go willy-nilly. A provider can't go willy-nilly and go and try to do something they shouldn't be doing.
Yeah.
I will say in mode, they know this, you can't even turn the device on and even do a treatment until you have gone through and passed the clinical training. They're very big on that. And so they just don't want the device in someone's hands that are gonna have an adverse outcome. That's one big thing.
This has worked so well, and as an engineer, you'll really appreciate this. InMode has been able to duplicate their quality everywhere they go. And now we're talking about thousands of different people and personalities and what they do, and they have been able to duplicate the quality and the results everywhere they go with this piece of equipment. No other piece of equipment, no microneedling equipment, no other equipment can say that. You look at the quality engineering that went into this thing, it was like, oh, they took care of all the variables out of the question and made it very easy.
Well, radio frequency now, technology is being used. Obviously, I said this earlier for the patients that have been here earlier. We actually had a device that treats dry eye. We have a device that treats male, issues. We have a device now, female issues. I mean, this is not just aesthetics, even though we started as an aesthetic company. I love the fact that now we can go into the health and wellness aspect of it too.
The dry eye that she's talking
Yeah.
about, it's a huge problem. We don't have a cure for that. We don't have
suffer
a treatment
from
for
that.
Me
it.
too.
This excessive sweating,
Yeah.
called hyperhidrosis,
You can treat
it's a
that.
real big bother for people, and they've come up with medications and thousands of dollars to try to treat that. This device treats it. It's 80%
Hands.
gone, 90%
Yeah.
gone.
We do hands, underarms, the
Yeah.
bottom of the feet. A lot of patients get, issues with that.
How do you treat the
Botox has always been used for it, thousands of dollars for Botox,
I'll show-
and you're doing it every 3 months.
Temporary.
But what I was gonna say is that, like, if anybody has any specific questions, Misty's gonna do, the VTone and any questions you have with that, we can do complimentary consults, mini consultations. And then we can both go over the pricing with you. Obviously Dr. Bob too, if you wanna speak to him. But if any of you guys would like to do a consult, we're more than happy to do it, for you guys. You being the first student here,